From the treatment standpoint, you're a technocrat. You know, it is business, it's engineering in a way. But from the social standpoint, you're part father, you're part mother, you're part brother, part sister, maybe part son and daughter to a patient. You're a social worker, you're a hand holder, you're a cheerleader, you're a shoulder to cry on, you're a lot of things. But you may not be everything to everybody. You may be one thing to one patient and something different to somebody else. And the question is, where do you fill in the gap? Some people may have a great support system and you really are just the quarterback, the one that helps arrange everything. Some people may have no one, or some patients may have someone or no one that's equipped. And there you're the coach. Hey, you need to do this, that, and the other to survive this, you know, not just your chemotherapy. That is a big part of it, but your job, your family, your life. So you do a lot of things and you draw on not just your professional experience, but your personal experience.
Often when a woman comes and they're first diagnosed and they come to me, I mean, their world is turned upside down. And they really have had a lot of information given to them. Their focus tends to be, what's my next step, my treatment, but their worries are all for their family versus themselves. How's my spouse going to do it, my parents, my children, how am I going to maintain my job while going through treatment. So there are financial aspects to it, a lot of emotional issues and role issues. How can I still be the person I am and follow through my daily routine and my responsibilities while taking treatment?
It's interesting as you follow them through their journey. They get through chemotherapy, they get through surgery, they're going through radiation, sometimes up to 6 weeks, and I'm seeing them once a week through their treatment, and they get torn down. Not only physically, it's hard, it's taxing, but emotionally, and they're worn out. And what is interesting is after treatment, they should be getting better, and I see them, month, 3 months afterwards, and surprisingly, that's when their diagnosis usually catches up to them. They go through treatment and they have this adrenaline push that they're gonna fight this, and they're gonna beat this. And they go through that whole cycle, and then once they're done with radiation, it hits them. Oh my goodness, I've got cancer. How am I gonna get back to living my life? I don't feel normal. I can't be a mom, I can't be a wife. I don't feel like myself, I'm exhausted. And it's surprisingly when I see the most depression, it's not during treatment, it's afterwards. And it's living then with this diagnosis, and how do you get them back to feeling somewhat normal?
I had finished my radiation treatment and gone back to see Lauren for a follow-up appointment, and I was pretty beat up that day.
And I remember looking at her and being like, what's wrong? You're done. And she looked at me and said, I just feel guilty. I remember feeling guilty that I haven't been here for my family, and that I feel like I can't be a mother to my children, and that I haven't been a wife to my husband. And you could see it in her eyes, and the guilt that she hadn't been herself. And she was stressed and going back to work and getting on with her life, but not feeling like she was who she was. And I remember looking at her and saying, do you need a break? Do you need a break from this all? And she paused, and everybody who talked to her knew she needed a break.
And it just sounded so foreign to me. I at that point didn't really know what to say. And I had raised my head up and she said, do you need a break? And I said, yes, I need a break.
And she's like, I can't afford to take one. And I remember thinking, you got to. This is what you need now. There's nothing I can do to help you with your cancer. You need to take care of yourself. You need to live your life. And she needed some fun in her life. And I remember asking her, is it okay if we nominate you for this foundation? And she was just shocked, I think, initially.
And the weather was so bleak, and it was really cold outside. And that's kind of how I felt myself. And to have her offer that to me, and then the possibility of actually having fun with my family again was just beyond words.
And after the vacation, she came in, she was smiling, she seemed happy, she was very grateful. It was like back to the person that she was. Even back right when we were starting radiation, she was just such a joyful person, and to see her be able to get back to that. And you're never the same after cancer, I get that, but a piece of her has come back.
It's the small things that really make a difference. It's really taught me to slow down and just enjoy the moment and enjoy the children talking to you and enjoy what they're doing. Don't worry about having to make everything perfect, and then also don't feel sick at that time. It's like it's like your body just, the stress is gone so that you feel better. You just physically feel better. And that was a big deal for us and for me.
Being able to say to somebody, I know a foundation that can bring you fun again, that can bring your family together, that can give you a break from your treatments, from the routine of doctor's appointments, and take you away for a week, is just so rewarding. So I'm so enthusiastic about and such a supporter of what the Wellington Foundation does. And it's indescribable to watch a woman's face when you tell her that. I mean, tears of joy, of just being overwhelmed by someone would do that for me, for us. It's really very special.
Most people don't get what it takes to be happy. And everyone thinks, well, if I just get this one more thing, or I get this job, or I get this car, that I'm going to be happy. And very few people get the concept that happiness does not come from getting, it comes from giving. And it's even better if you can give at a personal level, or you can know a real person and their real struggles and their real concerns, and make their life a little easier, even if it's just for a week or two. It gives me a great amount of personal happiness and pleasure. And that's how it should be.
In the medical world, I can treat cancer, I can help a patient through radiation treatment, but there's such that other side to them where they have to keep living, and you lose that through treatment. And so to be able to help them connect with local communities, to help them get through their treatment and to help them get through their life and have a little bit of fun doing it, that's really amazing.
Because they're trying just to eradicate that cancer, and to have that patient have the best possible life that they can. And that's all they're there to do, is try to help you. And they do that not just with, the means of the medicines and the treatments and things like that, but just their hearts. They just really care. And I can feel that, and that's what's so important. And that's what Dr. Castellini, she has no idea how she helped me that day. Made a difference.